There are a lot of reasons for doing a fellowship in complex spine surgery. And really, whether you're coming into the field from orthopedic surgery or neurosurgery, I think there are many advantages that will really serve you throughout your career. In this video, we're going to talk about what, in my opinion, are the top 5 reasons for doing a fellowship in complex spine surgery. We'll start from what I think are the least important reasons and work our way towards the most important reasons for doing a fellowship. Number 5, network. Whether you're coming at fellowship from neurosurgery or orthopedic surgery, chances are you know a number of spine surgeons already, and you'll have worked with them in the operating room, you'll have seen maybe some patients with them in clinic and talked about inpatients with them during the course of your training. Having said that, when you do a fellowship, especially at a different program, you more than double, usually, the number of surgeons that you know. And that can have a few different implications. One, it can help you find a job. So you might say that you want to get a job in, say, the Pacific Northwest or in Texas or wherever, Florida. And chances are, as you explore job opportunities, you're going to come across practices you like. Chances are, if you have twice the network, you're much more likely to know somebody or work closely with somebody who might have a connection there. So helping to get a job is a real important value to having a strong network. It might even help you identify jobs. If you go to a mentor, for example, and say, hey, I really love to get a job in Dallas or whatever, chances are they know people and can kind of get a lay of the land, or San Diego or Chicago or whatever it might be. So getting a job is an important value to having a broad network. Another very important strength is in being able to bounce cases off of people when you first go into practice. Inevitably, when you start, there are going to be cases that you find challenging. And it's not usually the surgical part that you're going to find challenging, it's the decision-making that you're going to find challenging. So being able to bounce cases off of a mentor or somebody you really respect, or even many people to come to an answer, that's something that happens regularly to me, where I have fellows that practice or that are now starting practice reach out to me with cases, send me pictures and say, hey, what would you do for this 64-year-old gentleman with this prior history? And we weigh in on it. And I think having a strong network allows you to kind of make the transition to practice much smoother. Number 4, credentialing. When you go into practice, depending on the type of environment you want to practice in, you might find yourself in a very competitive space. So if you want to practice in a big city, chances are there are a lot of spine surgeons there, and they could be neurosurgeons, they could be orthopedic surgeons. But if you want to distinguish yourself and hang a shingle as a new spine surgeon, it really helps you a lot to have a fellowship credential behind you. No matter how well you know the people in the community, chances are when you go into competition with them, they're going to take advantage of any weakness you might have. And not overtly, but tell patients that might have seen you like, well, he's not fellowship trained or she's not fellowship trained. So having that credential behind you helps you really career long establish and assert yourself as being as well trained in spine surgery as anybody can be in the United States. So credentialing, you can't really put a price on that, but I think the value of that when you're marketing to patients, especially in a competitive area, is huge. Number 3, practice management and billing. When you first start practice, figuring out how to get a reputation, how to network, how to reach out to your customer, how to take care of patients, all of that stuff can be challenging. And if you haven't really learned how to do that in residency, which is more common than you think, when you first go into practice, you're going to be kind of figuring it out on the go. I think it's incredibly valuable to go to a fellowship program where people have established practices and really try to understand what it takes to build a practice and manage a practice effectively. How many nurse practitioners or PAs do you need? Do you need nursing? What's the role of MAs and nurses in your practice? How do you deliver really exceptional patient care in a competitive environment? So I consider all of that part of practice management. And within the same vein, often during residency, the financial dimensions of healthcare are things that are kind of stigmatized. You don't really talk about, billing and how much you make for cases and stuff. Fellowship is an opportunity to say, look, if I'm in practice and I'm thinking about a patient and doing a surgery, what kind of codes do you submit for that? How do you bill appropriately? What's overbilling and underbilling? When you're seeing patients in clinic, how do you document? A lot of that stuff is stuff that will serve you in spades down the road when you're in practice. So I think practice management and billing, learning that stuff, fellowship is the perfect opportunity for it. Number 2, surgical techniques. When you first go into fellowship, The principal draw is that you're going to learn how to perform surgery. And obviously that's an important factor, an important component of your fellowship. But what I found myself, and I tell people all the time, is that there's nothing I did in my fellowship in the OR that I hadn't already done in residency in terms of procedures, but I did learn a lot of different ways of doing the same thing. So even if you've seen ACDFs and posterior cervicals and T-lifts and laminectomies in the past, it's really nice to be able to see a lot of new ways of doing it so you can kind of pick and choose from different surgeons and figure out how you like to do things best. And that goes beyond even just surgical techniques. It's positioning and managing the OR and managing your schedule. All of that is stuff that you don't just want to draw from 3 or 4 people. You really want to see a lot of ways of doing it to figure out how you can do it best. So really, the idea of surgical proficiency is not just knowing how to do a procedure, but knowing a lot of ways of doing procedures. And that can help you get out of trouble if you know a lot of ways of getting out of trouble. And it can help you a lot with managing a room, and it can help you a lot with defining your own personal way that you like to do these procedures best. So surgery, there's more to it than just learning the different steps. There's a lot of strength and confidence that you get from learning a lot of ways of doing the same procedures. And the number one reason, in my opinion, for doing a fellowship in complex spine surgery is to learn effective decision-making. Decision-making is really about seeing a patient, being able to deconstruct their symptoms so you understand it in a very structured and rational way, being able to think through the goals of surgery, understand the different techniques that you've got, and figure out how you're going to approach solving that patient's problem. Decision-making is really at the center of spine surgery. Failures in spine surgery, as I say to a lot of residents and fellows, it's usually not a technical failure. It's usually a failure of decision-making. You might have picked the wrong procedure for that patient, might have picked the wrong type of instrumentation or the wrong surgical strategy. You might have even operated on somebody probably didn't make sense to operate on. In my opinion, learning all of that happens in clinic, and really getting effective clinic time is important. And most residencies don't really, especially in neurosurgery, don't really emphasize clinic enough. I think one of the things that we do in our fellowship program, and one of the things that I think is really important to get out of fellowship, is time in clinic, time with people that have been spine surgeons for a while, where you can really kind of kick around, how do they think about these spine surgical problems? How do they think about these patients? How do they decide what non-surgical treatment to use and why? And how do they think about what surgery to do and why? You're gonna leave fellowship, chances are, with a pretty broad technical skill set. Probably you'd feel comfortable doing most spine surgical procedures, but knowing when to do it and who to do it on, that is really at the crux of success. I think that's a critical ingredient for success as a spine surgeon, and probably the single most valuable thing that you'll get out of fellowship: problem solving and patient selection and decision making. Those are my top 5 reasons for doing a fellowship in complex spine surgery. There are admittedly other reasons for doing it that are individual. You might find yourself interested in moving to an area and think, if I do a fellowship geographically in that area, it will help me get a job. Sure, that's true. And sometimes people do that. You might find that taking a year off, for example, could be a little bit more of a cushy year and a time to kind of find a job and spend time with family and travel and things like that. I wouldn't call fellowship a vacation, but it certainly is easier than chief residency. So that's a consideration as well. You might find that you really want to explore teaching in earnest and teach residents and medical students and see if that's something you want to do as part of your career. All of those, I think, are good reasons for doing a fellowship as well. If you want to commit your career to spine surgery, in my opinion, it strongly benefits you to do a fellowship for all of the reasons that we mentioned above, the top 5 and then the ones we mentioned just now. I think at a minimum, it helps you with your ability to kind of figure out how to manage patients. It helps you with your surgical skills. It helps you build a practice, and it's going to help you with the network. And all of those things are things that you're going to draw on for the remainder of your career. So spine surgery, in my opinion, is an art form, and the fellowship really equips you with all of the assets and experiences you need to hit the ground running as a complex spine surgeon. I hope you found this video useful and valuable. I would welcome any comments that you have or questions you have in the comment section below. If there's things you want me to address in upcoming videos, I would welcome those and look forward to kind of commenting on those as well. If you find this type of content useful, please click like and subscribe so you can stay up to date on videos that I release going forward. I appreciate your attention, and I look forward to seeing you in a video coming soon.